Okay, well, I was asked to give an account of what's happened with the 5-year forward view for mental health, which is a little tedious because it's like going through a shopping list and whether or not you've bought everything. And however tedious it is for you, it's tedious, probably a bit more tedious for me because I've done it so many times. So I will try and go through fairly quickly, but before I do, just worth bearing in mind, there is a serious commitment to mental health from the Prime Minister through certainly the previous Secretary of State. I don't know with this Secretary of State, he's mainly focused on technology at the moment, but I've got no reason to believe that he's not as interested in mental health as the previous Secretary of State. NHS England has made a big commitment, Simon Stevens, all the way down, and we've got a huge team of about 105 people in NHS England working on policy, which is very, very different to how it was if you go back 6, 7 years where there was hardly anyone there. So big commitment. 5-year forward view aimed to put an extra £1 billion a year into adult mental health services and 1.4 billion extra over a 5-year period for children and young people. Now, as has been mentioned, there's a major rate limiting or step limiting factor in this, which is how quickly can you grow your workforce. If you want to expand up mental health, that means expanding up the workforce, since 90% of our spend is on the workforce. So what I'm going to tell you about, like a shopping list, is all the areas we've made an investment, how far we think we've got so far, and we can talk about whether or not we'll achieve our full aims by the end of 2021 at the end of this. So I'll come back to that in the panel. Okay, so anyone who's been to a mental health conference in the last 3 years will have seen this. It's the standard slide everyone shows. Those are the 12 commitments, or the 12 key commitments in different parts of the NHS. You've got copies of these, I'm pretty sure. So I'm not going to go through every single one, but I'm going to pick out a few. First one, perinatal mental health. It's been about gradually working out to about it's a total of £365 million being spent by the end of 2021. And so far, this is what we've done. So May 2018, 23 million awarded to 35 sites. My understanding is that certainly by the beginning of next year, we should have covered pretty much all of England with some sort of community-based perinatal mental health service. Now, when we started, 15% of the country had a perinatal mental health service. That doesn't mean to say that that women who are pregnant or after birth, that they had no access to mental health services. They did. And I personally have worked with a number of women through pregnancy and into post-delivery. What this has done is provided people with access to a specialist service which I do think is better, certainly better than what I was able to provide. So this is seriously good news. One of the areas that we've invested in and has finally started, I think, in Devon, is setting up some mother and baby units. So there have been mother and baby units around the country, but now we've tried to make sure that that they're as close to people's homes as possible. So 4 new mother and baby units. Children and young people, there's been quite a big investment in children, and that investment has continued with the Green Paper. So anyone who's tuned into the Green Paper. Green Paper means that we are gradually setting up over the next 10 years a new type of mental health service for children directly delivered into schools. Every school in 10 years will have a senior teacher who's trained up to understand mental health, and will work closely with these new teams that we are setting up called mental health support teams, and they will be linked directly to the existing CAMS services. And it's very likely that that investment and that interest in children's mental health services will continue in the long-term plan. I'm not telling you anything about what will be in it, but I think there is a likelihood that that focus and that interest in children's mental health will continue, not least because 50% of adult mental health problems begin by the time you're 14. And I did a systematic review which underpinned the Green Paper, which showed that getting in early stood a decent chance of reducing those who went on to have mental health problems as adults. Now, we took a proxy for that, but that's what we think is possible. So the sooner we get in to help people, the better. Accident emergency, so we've got liaison services. There was a commitment to put new money into liaison services, that by 2021, that 50% of all A&Es around the country would have liaison services which were consultant and nurse-led, being able to do a full range of assessments and interventions. People do ask why only 50%. Well, that's a workforce issue. We couldn't get enough liaison psychiatrists by 2021 to be able to do more than 50%. Improving access to psychological therapies, a big focus has been on long-term conditions. For those who aren't aware, if you have any long-term physical health problem, your likelihood of having a mental health problem is increased, and the more long-term conditions you have, which age almost inevitably brings, the more likely you are to have a mental health problem. So if you have 3 long-term physical health conditions, it's getting on for nearly 1 in 2 people will have a mental health problem. Most of those problems will be anxiety and depression. And when you look at the long-term outcome of those physical long-term conditions, diabetes, chronic obstructive airways disease, the long-term outcome is worse if you have an untreated mental health problem. And the cost to the NHS is about 50% greater because people don't take their insulin, for example, or they don't do it properly or whatever. So really important that we get mental health interventions delivered for this group of people. How am I doing for time? Good, okay. 2 areas where we've put some investment in to help bring back people to home. So one is in CAMS. There are a lot of tier 4 CAMS around the country, kids travelling long distances. So what we've done is we've said to localities, if you want to bring your kids back and you want to deliver tier 4 CAMS close to home, you can have the money if you then start using that money, shut beds, invest in local services. So it's sort of creating a connection between what currently is NHS England funded specialist CAMS services and getting them linked up to their locality. Now that, I think, will take some time to do. Having done this with acute care in adults and with locked rehab in my own locality in Sheffield, it took us 7 years to bring back all the acute out-of-area placements, probably a little bit less to do the locked rehab. So it's not a simple thing to do, but we are doing this, and we've got sites around the country who have started this, and we want more to do it. Now, we're doing the same with secure care, so low and medium secure, we're trying to, again, link up with localities. So, I'm not going to say much about this. There is a commitment for every CCG in the country to make sure that their investment in mental health, their basic investment in mental health parallels the increase in investment in acute physical health. And then on top of that, they're meant to spend money on the 5-year forward view. We are monitoring them and publishing it, and you can get that on NHS England's website. So if you may or may not understand how this works, NHS England gives the CCGs their money to then spend on their locality's health. If you give them extra money to spend on mental health, there is no absolute certainty that that will be passed on to mental health. And you do hear of places where they say, wait a minute, it hasn't been passed on. What we're doing is publishing that so you know who's doing it. I'm not saying that games don't get played, I'm sure they do, but it's terribly important that we make this whole thing transparent. These are the commitments over the next few years. I mean, basically, it's to achieve our targets. And some of those targets, when you look at them, they're not, you sort of think, my God, surely you must be more ambitious than that. So at the moment, or at the start of this process, we're providing evidence-based, nice concordant psychological treatments for people with anxiety and depression or common mental disorders. 15% of the population are getting those treatments. We expect to bump that up to a quarter by the end of this 5-year plan, okay? We want to bump that up further still, obviously, but again, this involves expanding up the workforce, training new people, and you know, I can say at this point, there is a real interest in us using people who've got lived experience, who've say, had an eating disorder, they've moved on, and they want to come back and they want to help people with eating disorders. Great news. So people with lived experience, people who are psychology graduates coming out of universities, these are all groups of people who I think would be very, very keen to come and work in mental health. So we're finding innovative ways of expanding the workforce whilst we increase the throughput of doctors to become psychiatrists. We've got a 30% rise in doctors applying to come into psychiatry this year. We want the same to happen in nursing, etc. But in the meantime, there are a lot of people out there who would like to work in mental health, and we want to help them do that. So all of those will happen. I just want to mention something that the previous Secretary of State asked us to set up in NHS improvement. I work part-time in NHS improvement as well as NHS England. He asked us to set up a patient safety improvement programme, which we agreed to do. We're doing it with the CQC. We've got a number of very experienced people like Geraldine Strathdy and Stephen Fern and so on, who are working with us. And they're going into trusts and helping them with patient safety in mental health. And this just tells you how that came about. State of care report, Secretary of State, blah, blah, blah. The point is that we want to get quality improvement going at scale into mental health. If you look at trusts like East London and NTW, you know, these are fantastic trusts that have got some really serious quality programs going, and they've got there by making big investments in quality improvement. And areas like Tees, Esk and Wear Valley have, as a direct result of their QI input, saved £50 million in the last 10 years. All their CIPs, their cost improvement programs, have been done through QI. So we'd like to see more of that. And that's roughly how we're going to work it. But once this is up and running, this will be in about a year to 18 months' time. When the CQC goes in, we will go in from NHS improvement. We will try and broker relationships with trusts who will be able to help, but we will also have some investment to help develop QI, so that when the CQC comes around again, that they'll be looking at the extent to which we've achieved what we've set out to do with those trusts. And that's the sort of support that we're going to be able to give them. So, on that note, I don't think I want to say any more. Very happy to answer questions later on. So have I filled the time? Done?
That's lovely, thank you, yeah.
Okay, cool. Thank you very much.